Hi, my name is Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Friday, May 8th, and this is my daily briefing. First, I just want to let everyone know that you will not be hearing from me on Monday. I'm going to take a much-needed 3-day weekend, and I will be back on Tuesday. So as of today, we've had 41 cases in Missoula County. 39 of those were identified by testing and 2 were epi-linked. We've had 40 recoveries and 1 death. We currently have no active cases and no close contacts. The state has had a total of 458 cases, which is up 2 from yesterday, and there have been 16 deaths statewide. First, I want to talk about the governor's announcement. The governor's office announced expanded openings under phase 1 of his reopening plan yesterday. So starting next Friday, May 15th, gyms, fitness studios, and gym pools can resume operations with some limitations, and I will cover some of those today. The governor's announcement allows gyms to operate at 50% capacity for registered members only. Facilities must disinfect equipment regularly. They must train employees on symptoms of COVID-19 and on proper hand washing. Facilities must provide hand sanitizer and post signs with symptoms of COVID-19 to alert their members. Employees should wear face coverings. Facilities should provide 6 feet between equipment. Indoor classes are still prohibited per the governor's order. Outdoor classes must maintain the social distancing requirements or limit classes to 10 people. Gym pools may open to registered members and must operate at half capacity. The pool must maintain proper water chemistry and train staff on symptoms and hand washing. Aquatic classes can resume with strict social distancing, and the pool must post signs about symptoms and support social distancing between users and other members. Theaters and non-tactile museums may open at 50% normal capacity, increased cleaning and disinfection, and supported social distancing. 6 feet must be maintained between groups, including in seating areas of theaters. Cleaning and sanitizing has to happen between each show, especially for high-touch surfaces like armrests. The state has not moved to phase 2, and bowling alleys, concert halls, music halls, performing theaters, bingo halls, and pools not associated with public accommodations or gyms and tactile museums must remain closed per Governor Bullock. Gatherings are still restricted to 10 people without social distancing, and the traveler's quarantine remains in effect per the governor's orders. Earlier today, our local health officer updated her orders. Touch services and personal care can open on the 11th, providing that they have a plan to support social distancing measures, employee health, and enhance cleaning and sanitizing. She also outlines provisions for farmers markets and graduation, and increases the limit on events. So please check out the video of our press conference, which we posted today for additional information. We understand that these facilities are likely eager for guidance, but just ask for a little bit of time to get this together for you. So next I want to talk a little bit about COVID-19 deaths compared to what we typically see with the flu. In Montana, we've been fortunate that COVID has not really affected us as much as other places in the country. We have the lowest R0, which simply put is how many people a sick person can infect. We also have some of the lowest hospitalization and mortality rates. So far, we've been really lucky. We've seen and heard comments from members in our community that flu is worse than COVID. We've talked repeatedly about how this is not true. There is no treatment for COVID. There's no vaccine for COVID. This virus is also much more contagious, and everyone is susceptible. Additionally, the mortality rate is much different. People who are comparing flu deaths don't understand that the numbers aren't comparable without some sort of adjustment. The number of flu deaths that the CDC reports annually are estimates. They take the confirmed flu deaths and adjust for underreporting, since not everyone gets a flu test. This is different than how we're counting the deaths for COVID-19. As we've discussed previously, the deaths reported from COVID-19 are from confirmed cases or cases that meet the case definition. This number is not adjusted for underreporting like the flu. In order to compare flu to COVID, you would need to compare confirmed flu deaths with confirmed COVID-19 deaths. And what's even more telling is to look at the numbers over time. The last flu season ranged from 3,448 to 15,620 confirmed deaths. To get an idea of how flu deaths are reported, let's use the 2018 to 2019 flu season as an example. It had 7,172 confirmed flu deaths, but after adjustment for underreporting, that number became an estimated 26,339 to 52,664 deaths. So can you see the difference there? Let's compare. As of yesterday at 5 p.m., Johns Hopkins reported 75,543 confirmed deaths from COVID-19 in the United States. Even if we took the worst flu season in the last 7 years, the number of confirmed deaths pales in comparison. 15,620 confirmed flu deaths compared to 75,543 from COVID. That's almost a 5-fold difference. And on average, it's more like an 8-fold difference. What's even worse is when you look at this over time. A flu season typically goes from October until April or May. That's 7 or 8 months. We're only 15 weeks past the first case of COVID-19 in the United States. So let me break this down. The 2017 to 2018 flu season went 29 weeks and had 15,620 confirmed flu deaths. That's about 540 confirmed deaths per week. We're at 75,543 confirmed COVID-19 deaths in 15 weeks. That's over 5,000 deaths per week on average. And in recent weeks, there have been several days where 2,000-ish people died per day. We are really lucky in Montana to be where we are right now, but just because we aren't seeing the same effects that other states are seeing, it doesn't mean that this isn't serious. It's actually really important for everyone to continue to be vigilant, make sure that you're maintaining proper social distancing, doing all of those preventative measures, because we're really not at the end of this, and it definitely could continue to get worse. So that's it for my daily briefing. Thanks to everyone for everything that you are doing out there in our community to keep each other safe and keep our community spread as low as possible. As I said before, I will not be posting a video on Monday. I'm going to take a little bit of a long weekend. And as always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CINDYFARR. You can follow us on Facebook at the Missoula City County Health Department. You can call 258-INFO or 258-4636 if you're experiencing symptoms of COVID-19 and would like to get a test done, or if you just have other questions about COVID-19. And also you can check out our website at missoula.co/cvirus. So until Tuesday, everyone, stay healthy.